a person has a pain, say father has a pain, so he will ignore his own thing. बच्चे को होगा तो तुरंत लेके चल देंगे, पिताजी को होगा तो तुरंत लेके चल देंगे. But we tend to ignore our own health. That is in our society. It is there. The message is out here: should not ignore and don't take prescriptions from the pharmacists.
Correct. Of course.
Consult a doctor. See, God has made our brain and spine up absolutely versatile organs. Absolutely versatile organs. When it is something which every day I wonder कि यार बनाया कैसे इन लोगों ने? How is nature has made us so beautiful.
Yes.
It's the no engineering can match it. सेहत ठीक रहेगी ना तो सब कुछ चलेगा.
सब कुछ ठीक चलेगा.
Even
Correct.
if you have a huge bank balance in a bigger apartment, and if you are not able to enjoy it because of a diabetes or blood pressure or a stroke or God forbid happens to anybody or a back problem, constant backache, then what's the use of it?
Will life ever feel normal again? This is one of those things that I'm really sure that a lot of people have asked you. When it comes to brain surgeries, when it comes to spine surgeries. So what does recovery look like today? Because a lot of people still have myths about all of these things. मेदांता सुपर स्पेशलिटी हॉस्पिटल नोएडा में हेल्थ केयर सिर्फ ट्रीटमेंट नहीं बल्कि ट्रस्ट, एक्सपर्टीज और टाइमली केयर का वादा है. एडवांस टेक्नोलॉजी, लीडिंग स्पेशलिस्ट एंड वर्ल्ड क्लास इंफ्रास्ट्रक्चर के साथ अब मेदांता आपके और भी करीब आ चुका है. राइट हियर इन नोएडा विद एन अप्रोच फोकस्ड ऑन बोथ केयर एंड क्योर, डिलीवर्ड विद कंपैशन एंड एथिकल हेल्थ केयर फॉर ऑल. इमरजेंसी हो या कॉम्प्लेक्स ट्रीटमेंट, हर मिनट और हर डायग्नोसिस बहुत ज़रूरी होता है और मेदांता नोएडा हर ज़रूरत के वक्त आपके साथ खड़ा है. अगर आप दिल्ली एनसीआर में कहीं भी हैं, क्रिटिकल मेडिकल केयर के लिए दिल्ली के ट्रैफिक में फंसने की टेंशन भी नहीं है, क्योंकि एक्सपर्ट ट्रीटमेंट अब पहले से कहीं ज़्यादा करीब है. और ये बात सच है कि इमरजेंसीज में सिर्फ वक्त नहीं, जिंदगियाँ बचानी होती हैं. एंड विद ट्रस्टेड लेगेसी ऑफ इंडियाज नंबर 1 हॉस्पिटल इज नाउ इन नोएडा, दैट इज मेदांता सुपर स्पेशलिटी हॉस्पिटल नोएडा, which is right here to provide healthcare truly designed for you and your loved ones. कई बार हमें ऐसा हेडेक होता है जो अक्सर रुकने का नाम ही नहीं लेता और कभी-कभी शायद घर लौटते वक्त ड्राइविंग के बीच अचानक ब्लैकआउट हो जाए, या फिर हमारे फादर या ग्रैंडफादर को जिन्हें सालों तक बैक पेन इग्नोर किया हो, जब तक उनके लिए चलना प्रॉपर्ली मुश्किल नहीं हो गया तब तक उन्हें शायद न्यूरोलॉजिकल इश्यूज समझ नहीं आते. न्यूरोलॉजिकल इश्यूज अक्सर धीरे और बिना किसी वार्निंग के शुरू होते हैं. सिम्टम्स जिन्हें लोग स्ट्रेस, फटीग या एज समझकर इग्नोर भी कर देते हैं, लेकिन कभी कभी सही वक्त पर अपने बॉडी के सिग्नल्स को समझना सब कुछ बदल सकता है. वेलकम टू हेल्थवाइज एंड आई एम योर होस्ट कार्तिक एंड वी आर जॉइंड बाय डॉक्टर मनीष वैश, who is a director and head of department Neurosciences at Medanta Hospital Noida with over 2 decades of experience in advanced brain and spine injuries. And to understand not just the science behind neurosurgery, but the very human stories behind recovery, resilience, and second chances. Welcome to the show, sir. Welcome to Healthwise.
Thank you so much, Kartik, for having me on Healthwise.
First of all, thank you so much, sir, for sparing your wonderful time with us, because I know that you got a very hectic schedule. And with 2 decades of experience, that is something that I'm very honored about, because you don't get to meet people very regularly who have this amount of experience every now and then. And of course, you come out from a profession which is completely selfless. 2 decades is a huge experience, and it only comes with hard work, it comes with resilience, it comes with dedication. So from the bottom of my heart, for a doctor to be inside a studio, it certainly warms the cockles of my heart, sir.
Thank you so much, Kartik, for such nice words. Thank you so much appreciated.
डॉक्टर, बहुत सी न्यूरोलॉजिकल कंडीशंस ड्रामेटिक तरीके से शुरू नहीं होती. कभी कभार रिकरिंग हेडेक्स होते हैं, हाथों में नमनेस, डिजीनेस, परसिस्टेंट बैक पेन, और ये सारी चीज़ों को हम एक रूटीन लाइफ का पार्ट बना लेते हैं. तो ऐसे कौन से अर्ली साइंस हैं, कौन से सिम्टम्स हैं जिन्हें लोगों को बिल्कुल भी इग्नोर नहीं करना चाहिए, चाहे वो छोटे ही क्यों ना हो?
See, Kartik, one thing you said very rightly. If a person has a pain, say father has a pain, so he will ignore his own thing. बच्चे को होगा तो तुरंत लेके चल देंगे, पिताजी को होगा तो तुरंत लेके चल देंगे. But we tend to ignore our own health. That is in our society, it is there. So just take for example a recurrent headache. So many times you will just ignore it for a migraine.
Correct.
People take on Disprin or many other medications like that. But if a headache which is accompanied by vomiting, a headache which is more when you are waking up in the morning,
Correct.
or a headache which wakes you up from the sleep. These are the red flags for a headache.
Okay.
A headache which is accompanied by blurring of vision, a headache which is accompanied by weakness of any part, or a speech problem should never be ignored. Similarly, like dizziness.
Correct.
See, dizziness is perfectly fine. Everybody gets that. But if you have a dizziness while walking all the time, if you're unable to balance yourself,
Correct.
if there is a associated memory loss, which your family notice, Papa bhul jate hai, Mama bhul jati ho.
Correct.
So those can't be ignored. Those can be signs of a condition which can be treated properly.
Absolutely.
Thereby you can come back to a normal life. Or back pain.
Correct.
I'll give you my own example. I suffering from back pain. Ignoring. I'm a neurosurgeon. हमको क्या मतलब I know everything here. So
Of course.
I took painkiller, took muscle relaxant, and one day it started shooting down on my leg. It's very recent, about 2 weeks back. So I just went up to MRI, got my MRI done. The moment I saw the MRI, I knew I need the surgery.
Okay.
I called up my partner, just operate me.
Correct.
And that too took a one day because I'm in a neurosurgeon and head of department.
Yes.
People had to have a discussion.
Yes.
So we ignored it for 48 hours just on the painkillers. So developed a weakness.
Of course.
So the message is out here, should not ignore. And don't take prescriptions from the pharmacists.
Correct. Of course.
Consult a doctor.
Correct. And sir, to be very precise about neurological disorders, of course, the families, they know this thing that the neurological emergencies that they have experienced in their life are very scary. They're scared the most because that one sudden fall, a road accident, for example, a stroke, someone collapsing without any warning is something that every one of us are worried about. And of course, people like me, people who are between the age group of 30 to 40, we are also very worried about neurological disorders with respect to their parents, because age is one of those big factors in it. And of course, if I witness a sudden fall, if I see a stroke, it is going to certainly give me a state of shock.
Absolutely.
And it is going to be really pounding on my brain.
Absolutely.
And for me to process it is going to be really hard. So from your experience, because you have been into this profession for good 20 years now, what usually goes through those first few minutes when somebody is in the emergency room? And how critical it is for that particular individual to get one of their relatives who is suffering from this, who had an experience like this, to reach those emergency rooms and get themselves treated?
This is a very important question, Kartik. What we call is time is brain, and brain is time.
Correct.
So, timely intervention, say a blood vessel got blocked, choked, because you have either previous cardiac ailment, or you're a smoker, or a lifestyle, whatever is the reason. So, a blood vessel got choked. If you have reached in time, that can be opened up with medicine, or it can be opened up mechanically by taking out the clot.
Okay.
So that is the difference between one, life and death, and second, more important than that, is to have a useful life. Having a paralyzed life or a useful life. Similarly, in old age, a fall has happened, and your Dadaji is okay, Dadiji is okay, chal raha hai. Again she falls, फिर भी चल रहा है, and one day you realize कि she is walking with the lurch.
Correct.
So what happens? A bleeding happens, it stops. A bleeding happens, it stops and keeps on accumulating. And that leads to a problem, either like if you have a memory, or weakness of one arm or one leg, or both arm or legs, or sudden unconsciousness. So these are the signs where a very streamlined process is. There are fantastic guideline research over a number of years and thousands of patients.
Correct.
Which can actually make a difference between back to life or in the bed.
In the bed, yes, of course.
So we have to be back to life.
And of course, sir, like you rightfully said, that, even if somebody experiences things like this and they continue their lives and they don't really go out for a treatment, of course, sooner or later we get to know that their body has felt an impact.
Yes.
And they are really going through something or the other. Yes. And that goes actually to my next question, that, we live in a country where medical negligence is at its peak. we don't really consult an expert. Like we were talking in the beginning, that of course we have got the mobile phones, the smartphones, and now we have got the chat GPTs, the artificial intelligence of the world, who can just give us answers about anything in just one single prompt. And because of that, I personally feel that a lot of people have stopped consulting the experts, irrespective of what profession they are into.
Absolutely.
And especially when you are into a profession like medical and like medicine, for example. Delayed treatment is something that you have also witnessed.
Yes.
A lot of patients might come to you, they have felt the concussion,
True.
they are limping, and of course, because of that, they haven't really consulted a doctor. But now with time, there is a delay in treatment. So what happens? What are those things that you consult to a patient when they come to you and they say that, oh, there is a delay in treatment now?
Kartik, there is something which is a willful ignorance, and another is where it happened.
That's certainly a food for thought to chew upon, yes.
Yeah.
Of course.
You see, there is this, remember a patient, small kid, and that kid had a tumor.
Okay.
We said this needs to be operated upon and we'll do good. Then comes I won't name it because it necessarily creates a controversy. Family went in for alternative treatment.
Okay. Correct.
It comes after 3 months when the tumor is now inoperable. It wrenches your heart. And I said, why don't you ask kyun nahi hua? So you get the answer, oh, that particular smell doesn't gel with my medicine. So these are the things which actually hurt you.
Correct.
And something there is, one of my patients, he had a tumor in the back of the head. They came and, दादा हमको पता ही नहीं चलो कि क्या होगा. अब तो हमको सुनाई नहीं दे रहा है, कर दो. But that is something where you empathize.
Correct.
Here you empathize, but at the same time you feel hurt कि यार ये पता था, टाइम से बताया था और कराया नहीं. So it makes a huge difference. You get it done in time. और problem हुआ तो ऐसे नहीं कि ठीक नहीं होगा. ऐसे नहीं. Like a spine patient. This patient had a tumor. It was a non-cancerous kind of tumor. And they came, they said कि नहीं हम try करना चाहते थे, हमने नहीं किया. Had a weakness, but recovered completely. But
Correct.
Because before going to an irreversible stage, see, God has made our brain and spine up absolutely versatile organs.
Absolutely.
Absolutely versatile organs. When it is something which every day I wonder कि बनाया कैसे इन लोगों ने? How his nature has made us so beautiful.
Beautiful. Yes.
No engineering can match it.
Of course.
And provided you intervene timely, you can be back to life. You can be back to work. You can be back to your family.
Correct.
Have a quality life.
So that fear of surgery, that that fear of paralysis, or for that matter, these early interventions are really important. And like you rightfully said, that people tend to ignore because they feel that it's a pain. It will disappear on its own. Otherwise, we'll take a muscle relaxant, we'll take an MR, we'll take an antibiotic, and probably it will heal us. But time and again, we have gotten a setback when we get to know that delayed treatment can actually take your life, and it can affect a lot of people, not just you as an individual, but your entire family. So what is that one piece of advice that you would really want to give to all of those people whenever they feel a sudden pain? Because why it's important, at times we get to hear that there is a 35-year-old boy who is suffering through this. There is a 60-year-old person who is suffering through this. And we feel that a 30-year-old is not going to be that, it's not going to affect him in such a way that it's going to be life-threatening for him, as far as compared to a 60-year-old, because apparently he's old. Age comes into existence. And this is why delayed treatments also happen. So what's that one piece of advice? Because of course the lifestyle changes, we know how we work, how we eat, has a lot of role to play in it.
Absolutely. See, Kartik, lifestyle, as you said, is like in my age, in my early childhood, or in even my adolescence and younger ages, we used to do a lot of outdoor activities.
Absolutely.
When we were kids, my mom used to say, "Ghar kab aayega?" Now I have to push my nephew and my daughter out of the house. Jao bhaja ke khelo.
Correct.
No physical activity. And the kind of spine problems which we used to see in my training days in 60s, nowadays we see in 30s, late 20s. So lifestyle needs to be changed. One piece of advice to everyone is that cut down on your mobile time.
Correct.
Do physical exercises. And physical exercise में नहीं कर सकते तो go out and play outdoor, run, play badminton, whatever. But do something outdoor. Don't just be on your chair and techies. You see, they'll have the thing on the tummy and
they'll continue to work. And with this hybrid work culture, of course, a lot of people have stopped using their study desk as a study desk or as a work desk. They are apparently happy doing it
storage
on a beanbag or on their respective beds, putting their laptops right on their chest and working.
True.
And of course, that's not really the right way to do it.
Probably we have become totally health unconscious. In our हमारा जो पूर्वज जैसे बोलेंगे ना, ग्रैंड पेरेंट्स और पेरेंट्स, दे उनका सेहत ठीक रहेगी ना तो सब कुछ चलेगा,
सब कुछ ठीक चलेगा.
इवन इफ यू हैव अ ह्यूज बैंक बैलेंस इन अ बिगर apartment, and if you are not able to enjoy it because of a diabetes or blood pressure or a stroke or God forbid happens to anybody, or a back problem, constant backache, then what's the use of it?
Correct. And doctor, whenever people talk about neurosurgery, this thought really pops up in their head that it's extremely invasive, it's risky, it comes with long recovery hours. But when we see how medical science has evolved, it has evolved how? Because now medicines have evolved.
True.
The techniques have evolved. There are minimally invasive treatment options that are available when it comes to advanced neurosurgical techniques for that matter. So how has these advanced minimally invasive techniques changed a life of a patient when they come to you for consultation and when they come to you actually for treatment?
That's an important question, Kartik. The technology in past decade has evolved tremendously. When we see in a day-to-day life also, similar thing has happened in neurosurgery also. For like a malignant brain tumor, a cancerous brain tumor, nowadays we use 5 modalities. 5 modalities. We will first map the fibers of the brain. vis-a-vis tumor means वो patient का हाथ पांव चलाने का, बोलने का fibers का and tumor का क्या relation है.
Correct.
We get that scan. We feed it that into a computerized navigation system.
Okay.
So that navigation knows ki where exactly the surgeon has to go. So we have made a plan. Then after that, we will, once you open up, we have an 4D ultrasound, which is in tandem with my operating microscope as well as in the navigation system.
Okay.
So I exactly know where the tumors are, where the working fibers are. Then on top of it, we have an electrical current measurement system from the brain to the rest of the body.
Okay.
So there comes in the thing, even if I am going towards the working fibers, then I'll know. Plus then we inject a dye into the patient which only tumor cells take up, nothing else takes up.
Okay.
You see, all these things were not there when I was a student. So now what happens, we can remove even the malignant tumors with such a precision and such a thing that the life and the quality of life, more importantly, improves tremendously. So this technology has totally changed the outcome and scenario. Now I talk in terms of not jaan bachega ki nahi, how you can go back to your working life.
Correct.
That is what has become important nowadays.
And doctor, today hospitals like Medanta Noida, they are equipped with advanced imaging systems. There are AI-assisted diagnostics. There are precision surgical technologies. And then there are high-end operation theatres. And of course, for a patient or a family member who is sitting outside the operation theatre, they go through a lot. But what difference does this technology actually make in real terms?
So Kartik, the technology makes a difference in terms, I'll tell you. Like I was telling you about the mapping of the fibers.
Correct.
Mapping of the fibers is basically a AI generated thing.
Okay.
So what happens, all this, my MRI detects what is happening in a functional MRI and then it gives me a data and pictures. Now all those data I feed it into a computer assisted system called neuronavigation.
Okay.
So that neuronavigation further extrapolates it. into the working fiber, because it has a data of lakhs and lakhs of fiber tracks which is tries to overlap.
Okay.
So we have a AI assistance out there. Then thirdly, I can actually perform a surgery in my office before going to the theater. That is all because of the AI. And secondly, we have started generating few agentic AI agentic tools for our own consumption, for like it's some gray area. You came to me.
Okay.
You don't want to go for many more opinions. Many times, second opinion,
course,
of
that
course,
happens,
is your right,
yes.
and of course, you want to. Even I am in your place, I will also go and take a second opinion.
Yes.
So, but you said, "Ki, nahi, doctor, sahab, I really don't want to go. You do me the research." No? So, we are developing a tool whereby we can real-time consult the other neurosurgeons or neurologists.
Correct.
Rather than just going through a chat GPT, which will put up on stock answers. Nothing is chat GPT, that's the most common AI tool people are using.
Yes.
But any of the AI tool. So what happens, the patient comes with a stock questions, which many times are non-relevant.
Correct.
And one thing which I don't want to offend any of the tech guys, in fact, my daughter and most of my friends are techies, is that the questions which doesn't have much of a relevance are by the techies. And I have just one query to techies.
Of course.
Have you ever made a bug-free software? There is no bug-free software which has ever been made by any firm in the world. And you want 100% assurance from a doctor.
Correct. Of course.
Not possible.
That's certainly a beautiful way to put it forward, yes.
So AI is a tool which helps a lot, and that has changed the way we operate.
Correct.
Because combining the ultrasound with microscope, when you're seeing in the microscope, you're seeing ultrasound imaging fused with the pre-imaging which you have taken in MRI.
Correct.
That is AI.
It's one of those helping hands, one of those assistants that make your life a little easy, but also need your guidance.
Yeah. It is like a GPS and ADAS combined.
That's a beautiful way to put it. Of course. And last but not the least, doctor, one thing I'm sure that a lot of people have, a lot of patients have come to you, they have said this thing to you. Will life ever feel normal again? This is one of those things that I'm really sure that a lot of people have asked you. When it comes to brain surgeries, when it comes to spine surgeries. So what does recovery look like today? Because a lot of people still have myths about all of these things that, you know, like we were talking earlier, that neurosurgery, it's going to take a long time. The recovery hours going to be pretty long. So how does recovery look like today?
Kartik, I'll give you two examples out here. There was one patient who had a massive brain tumor, came to us in an unconscious state.
Okay.
And we operated. The surgery lasted around 12-13 hours. We reconstructed everything. That young boy went back. When I told the family ki with that kind of tumor and kind of reconstruction we had done, 6 months to a year and a half he has. Okay. And I met this boy about 10 days back. He himself is a doctor.
Okay.
Wife is also a doctor. And I saw him after a decade now. And he left IT in a medical profession, went into change the field, and he's a CEO of a company earning in dollar. He's a dollar millionaire.
Okay.
Now in 10 years, post surgery, which we never expected.
Huh?
So what I say, I take a very philosophical view when I have myself been through a spine surgery now.
Correct.
So it is all in the mind how you want to recover.
Correct.
Because again, the brain and spine are very versatile. The more you use it, the better we use it, the positive mind frame you have, you will be doing good. So, end of the day, I feel a neurosurgeon should be able to do a surgery with the precision, with perfect honesty, and the way it has to be done. Recovery do happen, and recoveries happen very nicely nowadays. Means I'm back to work operating 5 days after the surgery.
Correct. And doctor, hope, a 4-letter word, a small word with such a beautiful meaning.
Yes, absolutely.
Goes hand in hand with recovery.
Absolutely.
And like we were rightfully talking about, will life ever be normal again? How how does Medanta Noida stand in tandem with people and their families who are suffering and who come for treatment and now they are looking forward to their life filled with hope, filled with recovery?
We have a complete 360-degree kind of plan out here. That the philosophy of our team at Medanta Noida is that we just not give medicine, we just not do surgery. We hold the hand. And we never leave the hand till patient wants to get it leave. Number one. For that, we have meditation systems in our department.
Correct.
We have relaxation systems, guided relaxation, guided meditations. We have a full rehab program of 7 weeks post brain surgery, post spine surgery, or even a preventive thing also for our office going guys who have backache, neck ache, headache, सब चल रहा है. तो वो आगे जाके सर्जिकल प्रॉब्लम में कन्वर्ट नहीं हो. So we have that program also. So we conduct the it's just not कि आया सर्जरी करना है, आया दवाई देना है. It's not a mechanical thing.
Correct.
Medicine can never be a mechanical thing. It has to be a...
Well, thank you so much, doctor, for sparing your wonderful time with us. And I know that, sometimes healthcare is not just about machines, scans, or surgeries. At times, it's about getting the right kind of help at the right moment of time. And it's about the patient walking again, the patient speaking to you again, the family is getting another chance. And this is something that is really important. And of course, you are somebody who is giving hope to people, which an amount of experience that you hold in your arsenal and so proudly as a souvenir on your shoulder. We certainly thank you from the bottom of our heart for you to be here, to spare your wonderful time with us, and for sharing such beautiful insights about neurosurgery, because we know that there are a lot of myths when it comes to neurosurgery for a layman people who is undergoing through something or their families are going through something. But of course, with these beautiful insights that you just poured in so beautifully, like, throwing those visiting cards on the crossroad, we thank you from the bottom of my heart for you to be here, to spare your wonderful time. And it was indeed a really nice conversation and a very insightful one. So thank you so much, doctor.
Thank you so much, Kartik and Healthwise, for having us. And we are always there for any queries. You can direct it to either through you or through our offices. Any queries, even if you think it is not something which is very lame, no, nothing is lame. Any query which comes to you pertaining to brain and spine, to your audiences, to your viewers, we will be answering you.
कभी कभी हेल्थ केयर सिर्फ मशीन, स्कैन्स या सर्जरीज तक लिमिटेड नहीं होता, और हर सक्सेसफुल रिकवरी के पीछे एक्सपर्टीज, टेक्नोलॉजी और ह्यूमन केयर का परफेक्ट बैलेंस होना बहुत जरूरी है. Thank you so much, doctor, for sparing your wonderful time with us and sharing such wonderful insights. I'm sure जो हमारे listeners हैं, जो लोग ये podcast सुनेंगे या देखेंगे, उनके लिए एक बहुत ही valuable lesson होने वाला है. And for everyone out there, you are watching Healthwise in association with Medanta Hospital, Noida. Until next time, stay aware, stay healthy. This is your host Kartik, signing off.